Welcome to the Northwestern Memorial Hospital Department of Emergency Medicine. Our program started in 1973 as one of the oldest programs in the country in emergency medicine, and as such, we've helped pioneer the field of emergency medicine as it is today. We are excited to share with you a little bit about our program and what makes it so special.
Northwestern has provided trauma care for the Chicago downtown area for 30 years. Chicago is the third largest city in the U.S. with a population of over 3 million people. There are 5 adult level 1 trauma centers in the city of Chicago, and Northwestern Memorial Hospital is the only one in the downtown Chicago area. Our trauma catchment area extends beyond the loop from the southern edge of Lincoln Park down to the Bronzeville area. Of the trauma patients presenting to the ED, about 15% are penetrating traumatic injuries, leaving the other 85% to be blunt traumatic injuries. All airways in the Northwestern Emergency Department are managed by emergency medicine junior residents. Anesthesia does not come into the ED for any routine airways. This means, as a junior resident, you are in charge of all intubations in the department, especially your patient's airways, both in traumas and medical resuscitations. As for other trauma procedures like chest tubes, thoracotomies, central access, we have a great working relationship with our trauma colleagues and are able to share some of these procedures. It is important to note that our trauma bays are part of one of our main teaching teams. You will actively manage traumas as they present amidst the rest of your patient care. In addition, Northwestern ED residents have dedicated trauma rotations at Cook County hospitals during their 2nd and 4th year, and EM residents run traumas both at Gary and Lake Forest hospitals as well. All of our rooms are equipped to handle all critically ill patients, including procedures and intubations. You can take care of sick patients on every single shift. There is no patient too sick for the intern, and as an intern you get to see the sickest patients on day 1. A good example of this is one of our current residents placed the central line in the first hour of his first shift as an intern. Outside our ED, residents rotate through all the ICUs. They spend 10 critical care blocks of ICU time, including the trauma ICU. Most notably, there are no floor months. Specifically for the MICU, there is a dedicated emergency medicine MICU team, which is a great opportunity to continue the junior-senior level training experience.
Here at the NMH ED, we have 3 dedicated teaching teams. The teaching team structure allows junior residents to have a near-peer relationship, while senior residents can hone their skills in decision-making. Currently, our residents work 9-hour shifts during the week and 12-hour shifts on the weekends. This makes it so you can have more weekends off over the course of the month. On teaching teams, all residents start and end their shifts together, and we do this to encourage wellness and post-shift socialization. NUEM is a 4-year emergency medicine residency. We believe 4 years is essential for the expert preparation of a 21st century emergency physician. As a PGY1, your focus is on the mastery of seeing, diagnosing, and caring for patients. As a PGY2, we continue mastering emergency medicine, as well as building on efficiency to provide care for more patients. As a PGY3, the focus becomes learning how to supervise the entire team of junior residents, medical students, and mid-level providers. Finally, the role of a PGY4 is centered on how to work within the larger department with particular focus on flow, efficiency, and systems-level problems. This form of true graded responsibility ensures that our residents develop a deep understanding of efficiency, patient safety, patient satisfaction, operations, and quality assurance, and obviously bedside teaching. These are marketable skills that are important to prospective employers as demonstrated by our illustrious alumni. Our Care at Arrival team provides a break from our traditional teaching teams. It allows residents to have the opportunity to work one-on-one with our attendings. This fast track or vertical split flow model absorbs approximately 40% of the patient volume in any given day. Our Care at Arrival space affords residents the classic bread and butter experiences of emergency medicines, simple complaints, simple workups. Here, the residents hone their ability to make rapid decisions and work on efficiency and throughput while also improving their procedural skills. First-year residents rotate through this team specifically to cherry pick and focus on orthopedic presentations. They also work in our sports medicine and orthopedic clinic, where they get to work with our sports medicine trained faculty. We find this is a more beneficial approach to teaching EM physicians orthopedics, rather than a traditional rotation where you may manage patients on a floor or tag along for ortho consults. While you may occasionally see a pediatric patient through the NMH ED, the majority of our pediatric patients are seen at Lurie Children's Hospital across the street. Unlike many other programs, our pediatric shifts are integrated into our emergency department blocks, offering a longitudinal approach to caring for pediatric patients throughout your 4 years. In addition, our residents have the opportunity to care for pediatric patients at our community site rotations, where approximately 20% of patients presenting to those sites are peds.
One of the unique aspects of our ED is that we operate a 2-floor emergency department. We call our second floor the Mezzanine, better known as the Mezz. The Mezz mirrors the teaching teams on the first floor. Here we see more of our medically complex and chronically ill patients that come with practicing at a tertiary care hospital and destination medical center. In addition, the physical space of the Mezz is designed to care for the older adults with windows and doors designed to block sound, larger spaces for maneuverability, etc. We would be remiss if we didn't highlight some of our amazing people that make up our department and incredible team. To start, we are fortunate to have a fantastic group of APPs, nurses, and techs. They are truly rock stars. Additionally, we have an entire team that is devoted to improving the care of older adults in the ED, known as our Jedi team. Our work with the older adult population has garnered recognition as the first Level 1 geriatric ED in Illinois, one of only few in the country. We also have the unique perk of having 24-hour social workers and ED pharmacists available staffed in our ED. Our ED pharmacists are incredible teachers and provide a fantastic amount of on-shift teaching day and night. They are so dedicated to education that they also host ED pharmacy residents who participate in our operation initiatives and conferences regularly. Our social workers, quite frankly, are miracle workers and work around the clock to improve the care and lives of our vulnerable patients. They have also developed a transitional care clinic where our underserved, underinsured patients can receive follow-up care after their ED visit with us. They are also involved in a lot of our homeless and behavioral health initiatives within the department, as well as the Social EM Academy.
Thank you so much for taking the time to tour our emergency department with us. We hope you've gotten a better sense of who we are as a department and what we're about. For more information, please be sure to check out our website and our social media.